Joshi, you can start.
Yogastha Karukarmani Sangam Tekva Dhananjaya Siddha Siddhyo Samo Bhutva Samatvam Yoga Uchate. Be steadfast in the performance of your duty, O Arjun, abandoning the attachment to success and failure. Such equanimity is called yoga. This is what the Lord Krishna himself shares the knowledge of yoga to Arjuna and to the world. Yoga is a physical, mental health, peace of mind, and spiritual practice which originated in India. Today, we are celebrating International Yoga Day. Hi, welcome everyone. Thank you for joining us for today's webinar. Myself, Raghavendra Joshi, Associate Professor, Department of Mental Health Nursing, Sarodaya College of Nursing, Bangalore. Also, moderator for today's webinar. Today, we are conducting a webinar on account of International Yoga Day. Resource person for the day is Dr. V. Venugopal, Assistant Medical Officer, cum lecturer at Government Yoga and Naturopathy Medical College and Hospital, Chennai. As there is a limited capacity on Zoom, I request the participants who are unable to join on Zoom to join using the YouTube link which is shared. I also request participants to keep your audio on mute. If you have any questions regarding yoga during the presentation, please type them into the chat box. I will bring them up to the our today's guest at the end of the presentation. And we will also have time for queries and questions at the end. Now, without further ado, let's start. I call upon our dear principal, Dr. Dinesh Selvames, to highlight the theme of the day. I heartily welcome you, sir.
Thank you, Joshi. Good morning to everyone. And it gives me immense pleasure on this special day where we celebrate International Yoga Day to meet you all on behalf of Sarvodaya Group of Nursing Institutions. So first of all, with the blessings and wishes from our chairman, Sri Narayan Swamiji, and also our directors, Mr. Sunoj and Mr. George, and all the faculty and all the students. We welcome our respected special person of the day who is going to enlighten, Dr. Venugopal. Sir is very simple and very humble, and I know Sir and his contribution towards the diabetes patient and his contribution towards yoga and its spread to the patient care. So I was always used to see him, the way very humbly he conveys the message, and it will be so effective, and there will be a lot of utilization from what he talks. So it gives me great pleasure to have Dr. Venugopal Sir among us on this special day. Very much of a bouquet of love and thanks to Sir to have on the special day on behalf of Sarvodaya Group of Nursing Institutions. Thank you, Sir. So this International Yoga Day is being considered to be a very important aspect in India, where we yoga is already being considered as one of our natural resource, and it gives a holistic view where it gives balance between the mind, body, and spirit. That's what we all know, some basics about yoga. And there are a lot of studies and how yoga is coming up in today's life style, where yoga becomes a very important aspect in everyday's life to keep them healthy in this environment, which is out of a lot of pressure and stress and pollution. So yoga seems to be more beneficial. That's what we know, something basically on the literature, what we come across and know. But today, to know more about this yoga and its importance and its impact, and as a nursing student, we from nursing institution, the students, the nurses taking care of the patients for 24 hours in the bedside. So how they are going to carry this yoga to the patient and get some benefit for the patient's improvement and patient care. And apart from that, the nurses, the COVID era has enlightened the stress of the nurses and the importance of nurses in the healthcare industry. So nurses are considered to be very important in the healthcare nowadays. So how to keep themselves so healthy with the benefit of yoga? So this is going to be the main aspect and questions from our students and from our nursing fraternity. And we have an excellent person with various experienced knowledge in this field, our Dr. Venugopal, who is going to enlighten this session for all the nurses today. Thank you, sir, and thank you once again, everyone, and welcome you all for the session for on this particular International Yoga Day. Thank you.
Thank you, Dinesh sir. And now I would like to introduce our resource person. I'm really happy to introduce Dr. V. Venugopal, Assistant Medical Officer cum Lecturer at Government Yoga and Naturopathy Medical College and Hospital, Chennai. Dr. Venugopal is a yoga and naturopathy doctor and a diabetes researcher. He has completed his master's in diabetes from Edinburgh, PhD from Yesvasa University, Bengaluru. Dr. V. Venugopal has over 45 scientific research publications in Scopus and PubMed indexed journals. He is a professional member of Diabetes UK, Research Society for Study of Diabetes in India, and a first ever complementary therapy practitioner to be a member of the Young Diabetologist from a Forum UK. Dr. V. Venugopal has conducted over 650 plus awareness sessions on diabetes and lifestyle modifications across the world. With this introduction, now I heartily welcome Dr. V. Venugopal to take over the session.
Thank you so much, sir. Thank you, to the principal, sir, and Joshi, sir, for the introduction. So let us dive into this session right away. So I'm sure like everyone will be having a basic understanding on what yoga is. So that is what we are going to see today. Okay, so the topic that was given me is yoga for health and wellness. Okay, so I'm Dr. Venugopal, yoga naturopathy consultant and diabetes researcher from Naturopathy Hospital, Chennai. Okay, so let me start with a small story. Due to streaming issues, I'm turning my video off during the presentation. Kindly excuse me. Okay, so let me just start with a small story. What happened with Stop Diabetes movement? So this is a nationwide movement from Yesvasa University, Bengaluru. So this program actually started like around like 10-12 years back with the vision and mission to reduce the incidence and prevalence of diabetes in India through yoga. Okay, as simple and straightforward. They want to reduce the prevalence and incidence of diabetes in India through yoga. So what happened? They went and approached many endocrinologists, diabetologists, and other conventional practitioners. So, so when they're going and talking with the doctor, one of the doctors said, yoga can't do anything for diabetes because yoga is really slow. People with diabetes, they should actually do some fast kind of exercise so that they can lose weight. Only if they lose weight, too slow blood sugar levels in the body. That is the statement which he actually gave, and there was a conversation which went for like around like 20 to 25 minutes, which was not possible. And the team which went to talk to them, when they returned back, there was something, a note was a particular doctor which had do's and don'ts for diabetes. Okay, what are the diabetes? The don'ts list was yoga. Do not do yoga because the blood sugar levels, exercise and walking are much better than introduction. We will move into today's session. Okay, now why and what is the reason the particular doctor thought that yoga might not be beneficial? So I think that would be the best place to start as such. Okay, so what was the ideology behind it? I'm sure like there's some reason why it was told, and the major ideology there is because the way how we see it is because if you're obese, your insulin resistance increases, and that is leading to diabetes, right? So this definitely is one reason for that, but that is not the only one. Okay, so I just told like why exactly the doctor said so, and for the next few minutes, we'll just see what exactly yoga is and what are the things it can actually do. First, what is yoga? How generally people perceive yoga or see yoga as a slow form of physical activity, isn't it? It is something, even if you believe that it is so boring, it's not entertaining, all these things keep running in mind, we think yoga as a slow form of physical activity, and think it is like standing upside down as yoga. Okay, so that is not actually what yoga is. Yoga is a way of life. Yoga is a way of life. As mentioned in Bhagavad Gita, Yukta Arasya Yukta Chesasya Karmasu Yukta Swapna Avabodhasya Yogo Bhakti Yukta. Yoga is a way of life. It just talks about how to eat, how to do your exercise, how to sleep, stress management, and all other related components. So yoga is a holistic way of living. To put it in the simplest way possible, I'm sure like many of you would have heard of this word Ashtanga Yoga. Ashtanga Yoga are 8 limbs of yoga. The objective of yoga is to keep your mind like a clear lake. Okay, so your mind is always like a clear lake. When we are born, we are all happy. Children or the kids smile a lot, laugh a lot when that's the moment they enter school and college and so on and so forth. So many things happen in our mind. So here, the clear lake is attributed to the mind. Our mind is always like a clear lake, but what happens is our thought process, it's like throwing stones into the lake. Initially in the clear mind, we throw the first stone, the first wave comes out. Second stone, the next wave comes out. And so on and so forth, waves and waves and waves. So every thought process, every person creates a ripple in our mind, right? So if this keeps happening, automatically the clear lakes becomes a turbulent lake. We think and we worry about so many things in our day-to-day life, right? Like previously, stress was a survival mechanism. Stress is actually a mechanism. If there is any threat, either it be a lion, tiger, or a snake, or whatever we're encountering it, stress is a response for us to quickly fly away or fight and kill mechanism. That's what is called as the fight or flight mechanism. But modern thing, very getting late for something, or if you kept something somewhere, like losing our wallet and examination, if you're not performing well in the examination, any relationship, all these things, isn't it? Modern day stress is like, especially when I'm addressing a set of college students, all these small things would be, what to say, kind of emotionally so much burdening for you, like failing in exam or in a there's any relation with failure. Naturally, what happens is we think of 100 things in our mind. Okay, so this leads to health. Health, both I'm talking about the physical health as well as mental well-being, that gets worsened with it. Fine. So the health actually starts from your mind. Health starts from your thought process. Only then comes your asana, pranayama, and other things. So this is the major objective. The first and foremost objective of us to keep your mind clear, right? So keep your mind clear. When I'm taking sessions for my BMS students, I used to write like what to say, 5 to 6 words on the board to begin with. Like, say for example, the moment I say chocolate, when I say chocolate, what are the thoughts which would come in your mind? The first thing would be the sweet. Chocolate means celebration. Chocolate means happiness. Chocolate means love, success. The attribute, that one word chocolate, automatically sends your mind into different emotions, different thought process. Another example would be rose. The moment I say rose, few would attribute few would attribute it to the thorns, right? people would also attribute it to the thorns. Why is it so? Because it depends on the experiences which we have gone through that, right? The responses which the particular word, a particular name, a particular person triggers in your mind leads to a chain of reactions in your head that's going to act like all the way till your cortisol secretion. It's going to affect your body. So the ultimate aim of yoga is to keep your mind as a clear lake. And how to do it? Through 8 steps. Through 8 steps, what is called 8 steps of yoga or Ashtanga yoga. So that actually starts with Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, and Samadhi. So these are the 8 steps through which one can attain the ultimate purpose of yoga. Which what is it? Spiritually, it is about self-realization. If you're not worried about self-realization, at least the inner happiness, we get through all these 8 steps. So the first 2 was Yama and Niyama. Asanas, whenever someone talks about yoga, they talk about only asana, pranayama, do some meditation, and you'd all be relaxed, right? So asana only comes as a 3rd step. Only after asana comes your pranayama. From pranayama to meditation, there is 2 more steps, which is internalization and concentration. And after that is self-realization, samadhi. We are not going to look at samadhi, dharana, pratyahara. Asana, pranayama, and dhyana. These 3 are the things which we generally see. And today, just as students, as something which you have to know. So I'm going to touch upon these 2 things, Yama and Niyama, which is the 5 social ethics and 5 personal practices, which is helpful in the path of yoga. Okay, now what are these Yama and Niyama? Yama and Niyama are the moral principles. Moral principles would be like, what to say, too much to digest as such. Just think it as your thought process. Yama and Niyama is nothing but your thought process, how you should process all the your mind, how to process your inputs and other things. That is what is called as Yama and Niyama. Okay. For example, so these are 10 yamas, 5 yama and 5 niyama. For example, ahimsa. Ahimsa, what we all know is ahimsa is not getting angry, not scolding anyone, or not beating anyone, or not eating non-vegetarian foods. This is what we call it as ahimsa. But ahimsa, means not scolding others. It's not just like not beating others. It is not hurt inner thoughts. Okay, even inner thoughts, we should not hurt anyone. So that is what is called as ahimsa. Now, what ahimsa does? Buddha used to say beautifully, like if you're getting angry with someone, it is like throwing burning charcoal at them in bad hands. Right? So getting angry with someone is like throwing fire at someone with bad hands. It is going to hurt our hands first before hurting the other person. This is what we do every time. When we are angry with someone, it is not the other person who's getting hurt. Even before hurting them, your stress naturally, cortisol, stress hormone, all these things. I'm sure, like at this age, disease, it's not means much to you, because that is age for all that thing. But as nurses, as a nursing professional, you have to know the importance of stress and disease, the importance of non-communicable diseases, because 70% of the diseases are psychosomatic in origin. Okay, psychosomatic in origin, which means when we are depressed, when we are in fear, when we are angry with someone, naturally the cortisol and adrenaline and all these hormones goes off balance, which ends up in disease, right? So the first thing to do, the first person who gets benefited with ahimsa is us, is ourselves first, right? So I just have 2 take-home messages. Forgive and forget, right? Forgive and forget, not for the benefit of the others, but for our own benefit, Okay, so ahimsa is not hurting others, even by means of even the thought. The second thing, aparigraha, non-possessive. Right, again, we are talking to, or we're addressing to a group of adolescents, I believe. Okay, now this is the age, or this is the stage of your life that emotional intelligence means part of your brain is more active than the rational part of your brain. Fine. So whatever actions or decisions we take, it's mostly emotion driven than rational behavior, because the rational brain starts to pick up only, I mean, around like 18, 20, 21 years. It takes at least 21 to neatly take control or take over. Okay. Now, what is possessiveness? What is possessiveness that we generally encounter in our day-to-day life, in schools, colleges, or at, I mean, in relationship and other things? My professor explained it in a very beautiful way. Right, I mean, my professor Subramanian ji from SVSI University, how he mentioned us, like he is sitting in a train. He's sitting in a train which starts from Bangalore, reaching all the way. So sitting in the train, and chill breeze blow, evening 4 to 5 o'clock, wind is really which is standing in the station. Breeze flows to his hands. He's enjoying the cool breeze so much. He's enjoying it so much. He's happy. It's so pleasant, and everything was going on. After 3 to 4 minutes, he wants to enjoy that cool breeze for some more time. So what he does is, once the cool breeze goes in, he clenches his fist. So it, I mean, as if he's going to close his hands to catch the cold wind. What he does is he closes his hands. So what happens? Within a very short time, cool breeze which went, what would generally happen? It would start to heat up. Okay, started to heat up, and after some point, his arms start to sweat. Right? Then he opened the hand, let go of the air which was inside. Once again, cool breeze flowed in, and he is relaxed and happy once again. Right? Now, the same thing is true for relationship as well. The same thing is true for the relationships as well. Whenever we are in a relationship, we enjoy the relationship so much. At some point, we want to hold that relationship, hold that cool breeze within your hand. Giving you happiness, when you're trying to hold it for a longer time, closing it, the actual property of the breeze gets lost. The breeze is not happy. The person who is not happy as well. So the same thing happens in relationship, right? We are either the cold breeze, we are either the cool breeze, or the hand which is trying to hold. Either be the cold, neither way we are not happy. The best thing to do is let go. Allow the cool breeze to be cool breeze, and don't say like everyone makes friends with somebody who's jovial, who's enthusiastic, who makes people laugh. We make friends with such kind of people. But the moment they are into a relationship or into the friendship, immediately what happens is you should not be laughing and talking to person. You should only be laughing with me. You should only be talking to me. You should only show love to me. So that is like closing the cold breeze within your hand. So real happiness comes to both person only when you let go. I think this is one of the message which I want to convey to the college students and also to the students. Yeah, so that's the first message I want to tell you. Yoga, how personally it's going to benefit you. And now what is going to follow from this point forward is how it is going to be beneficial for the patients, and for your own physical health. Okay. I had put it in such a way that system-wise, this is all evidence-based, even though I have not put any research papers. I mean, the screenshot of the research papers, this is all from the research papers. So, okay. Now, talking about the skeletal system, first and foremost, it is much more easier and much more beneficial for obese patient to lose weight through yoga rather than doing a weight bearing exercises. Rather than doing any weight bearing exercises, yoga, what research shows that yoga helps in weight reduction, much more effective way, putting less strain on your weight bearing joints, right? So it could be anything from CS to LS, cervical spondylosis, spondylosis, spondylitis, to OAK or any condition, whatever you're talking about. Okay, I will come to about asanas. Okay, CS and Ls. And the next in the glucose inside the muscle cell fibers goes to the top of the cell to take glucose. Contracting muscle, there are some inside every cell. So these are the one which absorbs the glucose from the blood into the cells, lyses that. So naturally, the more glucose comes into the cells, which means there is a reduction in the insulin resistance. Now, insulin resistance is one of the key things in type 2 diabetes, PCOS, which is much common to, which is much getting very prevalent and common in these days. Atherosclerosis, dyslipidemia, and hypertension. Insulin resistance forms this central role of all these things, right? And as I said, like for any bone and joint related condition, because it reduces inflammation. Yoga is anti-inflammatory in nature. So this is about the insulin resistance pathway. How it helps in reducing insulin resistance is because, so whenever an insulin molecule comes and attaches on the insulin receptors, it cascades a set of chemical reactions inside. And these rings, these are the glucose transporters which I'm talking about. Now these rings move to the cell surface. So these rings move to the cell surface. So these are called the glucose transporters. So once these go inside, automatically glucose molecule can enter inside the body, and from this we get energy. Okay, now this is the insulin pathway. There is an alternate pathway through which exercise and metformin can do the same. Okay, this is called insulin independent pathway. Even in the absence of insulin, exercise and metformin can do this. I mean, let alone metformin. I'm talking about that. My area of expertise or topic which was given today is to talk about yoga and physical activity. So exercise involves muscle contraction, and has got muscle contraction aspect. What we call as isometric actions. We have isometric. Yoga comes under isometric exercise or isometric physical activity, and that's going to be beneficial in reducing insulin resistance. Okay. So talking about the next thing, inflammation. Yoga reduces inflammation as well. Now, another stretching. Whenever you are stretching a muscle, one thing is stretching. You are contracting an antagonist muscle naturally gets stretched. Okay, so any yoga class is stretching. So what this does is it helps in overcoming the inflammation defects. Okay, overcome it increases resolvers, reduces substantially, which increases permeability factor of inflammation. Okay, now yoga works on all these three aspects. So this is just about the musculoskeletal thing. What you can see in this main picture above here is what can inflammation do? Systemic inflammation, there are two things there. The local inflammation, there's something called systemic inflammation, organ system, from reproductive diseases, musculoskeletal diseases, like autoimmunity, all the way till cancer, one central pathway for everything, that is inflammation. Naturally, we call it like unity of disease and cure. The reason for all the disease is one, and the cure for all the diseases are one. That is to treat the cause of the disease. Here, the cause of the agent. Environment is a triggering factor, genetics is a triggering factor, but the key pathogenic about was beneficial. Okay. Right, now talking about, I told like I will talk about this LS and CS, right? Yoga is not just asanas. That's what we saw. Yoga involves and the diet when you're going to gym is the amount of content. People would have gone to gym for muscle bulk and muscle buildup, they tell to God is nitrogenous and excess nitrogenous end products. If you're not taking adequate amount of water, not taking adequate amount of fruits, and they use this word as vata. Vata actually means wind. It is nothing but the we are talking about due to excess osteoarthritis issue, and when you go to an Ayurvedic, first thing they tell you is to avoid foods which are rich in protein. They tell us to avoid pulses, single gram and all these grams. Why? Because that is rich in protein, and that in turn increases the nitrogenous end products. That in turn aggravates your osteoarthritis, CS, and MS. Okay. Now, the exact opposite of the protein. Okay, fine. Story as media. 13 years back. Of a young student who went to the gym and consumed what amount of protein powder, but the knowledge of the gym trainer, and twice the amount of the protein recommendation without the knowledge of the trainer. That means took 4 times the what is the prescribed amount of creatine taken by to be taken by a normal person, and within 4 months he ended up on a wheelchair. Femur got fractured, and there's multiple pain in multiple joints. Osteoporosis, let's say osteoporosis as well, and it was directly attributed to the protein he took without proper prescription as such. So I'm not taking gym powder is bad. My words carefully. I'm not saying this gym powder and supplements are bad. I'm telling you, taking it times the prescribed amount is very bad. Okay. And now the exact opposite of that is the yogic diet. So yogic diet is all about fruits and vegetables, because people who are doing yoga, especially asanas, they have to keep their muscles and joints and bones flexible. So naturally, the fruits and vegetables, which keeps them more flexible. That's one thing. Second thing is fruits and vegetables reduces inflammation directly. right? So it reduces the inflammation directly. And the third most important thing is something called as acid, ash, and alkaline ash forming diet. Yogic diet is alkaline ash forming diet. Which reduces the amount of free radicals inflammation and in turn helps in reducing the risk of cancer as well. Okay, so diet whenever you are into yoga, just as we initially saw, the mindset, the thought process, stress management is all as equally important as the diet, physical activity part involved in yoga. Okay, now coming to cardiovascular system. Talking about cardiovascular, opening natural collaterals. Collateral is nothing but natural bypass surgery kind of thing, you can say. Again, let me just talk about this gym example itself. People are going for the first time to the gym and who want to put on some muscle bulk and other things. When they're going and working out in gym in like say 3 to 4 weeks, slowly the muscles start to build up. Right. Now, where did this muscle come from? Is it coming from outside? Is it a new set of muscles have popped up or new set of bone? Nothing. The muscles are already there. The only thing that as the person was not working out, not just the physical activities, not even doing the basic things for practice of a lifestyle. So naturally, what happens is body will not give any nutrients or nutrition to those specific muscle fibers. It's not working. Why to waste money? Because those food and sending to who's not. So naturally, what body does is, like what is a kind of government policy, the nutrients would be sent to fibers, right? So naturally, what happens is the energy is given to only the and not for the people who are not working, to the fibers which are not working. But for the gym, what happens is those muscle fibers which were not previously, now it has started to work. So what body does is it sends glucose, it sends protein, it sends fat, all the essential nutrients, muscle fiber. So then you can see the muscle growing and hypertrophy starts. The same thing happens with your heart as well. Your heart has got 3 main blood vessels which supplies the heart. Heart supplies blood to all parts of the body, right? So the person who is supplying the food to everyone, he needs food as well. So the heart needs food as well. This food is supplied by 3 major blood vessels. There are also minor blood vessels. It is more the very, very small and it is not of any use. Okay. So what happens is generally when there is a clogging of this artery, I know like 3 arteries will be supplying the heart, right? If one of these arteries get blocked completely, that is called a single vessel disease. 2, it is double vessel, and 3, it is a triple vessel disease. That's how your generally doing any bypass surgery as such. What happens if there is any block? What we are doing is we are going to do a bypass surgery. What is a bypass surgery? A vein, not the artery, but a vein, a blood vessel gets cut from your legs or from your hands, and that small blood vessel will be connected, bypassing this block. So this block will be bypassed. So whatever blood is flowing through, it would take a new direction and then it would flow without affecting this. Right? But with yoga, what happens is there will be natural bypasses opening, not 1, not 2. There will be multiple bypasses will be naturally opening of practice. It's not about the asanas, it's not about standing upside down. I'm talking about Yama and other related practices. So this natural collaterals would be formed, helping to prevent atherosclerosis and to improve the the natural bypass thing. And blood pressure regulation. Okay. I think there are plenty of stories and research to be discussed, but as it's time gap, I'm just talking about one or two stories and then I'm moving ahead. For blood pressure regulation, body heals itself. So whenever blood pressure increases slightly, there's something called as baroreceptors. There's something called as baroreceptor. Baro means pressure, as simple as that. What these baroreceptor does is it senses increase in the blood pressure. So it transmits nerve signals to medulla oblongata. It stimulates the vagus nerve, and your heart rate varies in such a way that your blood pressure comes back to normal. Okay, so the baroreceptors or the receptors mean above your arch of aorta, as you can see here. These are the baroreceptor here. So that would be beneficial. Those are the pressures. Even diabetes, what you can see is the initial the blood sugar levels increases. Body tries to heal itself by increasing the amount of insulin being secreted. Okay. The problem is after a short point of time, after stuck, right? The same is for blood pressure as well. So initially, if I like to heal itself by sensitizing the bad, but after some point, the life is at that point we end up having high blood pressure. Okay, so these are the this is the first and foremost and primary thing that has to be kept in mind. And the next thing is, what happens is yoga. In fact, what research has shown us, it helps to improve the baroreceptor sensitivity. Right, so there's a study on yoga specifically. You can just Google for yoga and baroreceptor, and you can see that yoga helps in improving this blood pressure regulation in a person. Okay, and vagus nerve, everyone would be knowing about this parasympathetic nervous system, especially the vagus nerve, which stress response. For stress response, motivation is really important. Just back to normalcy. If you see a snake in the room in your sitting, naturally your heart rate increases, your BP increases, your sugar level increases momentarily, everything will be happening. But the moment the snake goes out of the room, everything would come back to normal. The person who's bringing everything back to normal is your parasympathetic nervous system, and yoga helps to keep your parasympathetic nervous system sharp and fine, right? And lipid profile test, like you name it, like whatever lipid profile, like to reduce the total cholesterol, LDL, triglyceride, non-HDL, for all these things, yoga is beneficial, and to improve the HDL as well, yoga is found to be beneficial. And varicose vein, like yoga along with a few naturopathy treatments, yoga has got some of the best relief as such. Not just raising your legs above, and I'm not talking about that. Something called as Brahmari Pranayama. Brahmar is a humming bee sound that is found to increase the amount of nitric oxide secretion. Okay, now nitric oxide, not just a vasodilator, it is beneficial in strengthening the blood vessel pumping capacity as well. Okay, so that is beneficial. And talking about respiratory system, right? During the times of COVID, yoga played a very COVID was not actually a lung-related condition, though it affects the respiratory system. It's got something to do with the inflammation of the lungs. That is the only thing. But apart from that, it's a systemic condition. Even today, post-COVID syndrome, we are seeing like n number of patients who keep coming because of problems in the blood vessel, problems related related to skin and all sort of things because of increase in inflammation. COVID patients, and the COVID wards, especially in ICU, many people recovered faster with yoga because yoga is beneficial in the lungs. When we are looking at respiration, process of respiration, the key thing is our lungs cannot expand by itself. So the muscles around the muscle around the ribs are the ones which allows our lungs to expand. Say for example here, diaphragm is called as the chief inspiratory muscle. Whenever we are breathing in, it is only the diaphragm which pushes our lung downwards and outwards, thereby reducing the partial pressure of lungs. Because of that, air from outside enters into the lungs. It is like just like an ink filler. We have to press the ink filler and then leave it so that through the ink filler, the ink moves in. Like whenever the intrathoracic air tends to go in. So what yoga practices we gave to this patients with COVID is the practices which strengthen the diaphragm, which is the chief inspiratory muscle, and also the accessory muscles of respiration. As you can see, the internal and external intercostal, pectoralis minor, major, and all these muscles. The moment we strengthen these muscles little by little, naturally people are able to breathe better, right? Of course, along with pranayamas for reducing inflammation and for oxygenation, all these things went in. But the chief way how to go over for the respiratory muscles is through activating the inspiratory and expiratory muscles. Okay, and the next thing is with holding your breath. When you're doing Nadi Shodhana, say for example, Nadi Shodhana, Pranayama, and most of the asanas, whatever we do, it allows more time for what we call as internal respiration. We are taking in oxygen, we are breathing out carbon dioxide as something external respiration, which happens between our nostril and our nose and our lungs. But the actual respiration happens only at the alveoli level, between the inner walls of the between the inner walls of the alveoli and the blood. The transfusion would be happening between these two places. What yoga does, through holding your breath, our blood is filled with more oxygen, giving more time for the carbon dioxide to get eliminated as well. And we found improvement in oxygen saturation, and for COPD, a very minor set of practices for people with breathlessness and related to COPD, they would get benefited. And talking about nervous system, it is beneficial for both nervous system and right. So autonomic nervous system, as you can see, that increases the heart rate and the sympathetic heart rate. Yoga brings about a balance between the both and predominantly working on your parasympathetic nervous system. And talking about the central nervous system, we are looking at different parts of the brain. What repeated EEG and fMRI studies and FNARS studies say is there is no part of the brain which cannot be lit by yoga. So all the studies on meditation and pranayama, what they have shown us, different parts of the brain gets activated with different sets of practices. Okay, and predominant one is your frontal cortex. As we all know, frontal your planning, execution, and all these factors are associated with your frontal brain. So what this does is, what yoga does is, it activates your frontal brain, your rational brain, rather than your emotional brain. That is what I was telling earlier. Your emotional brain is the one which is making us to take wrong decisions. Our emotional brain is the one which is which is not allowing us regular practice of yoga. What has been found is that it helps in activating the rational brain in a more logical manner. Ataxia, let's say in conditions like Parkinson's and in any problem related to neuromuscular origin or related to neuro, yoga has been found to be an confidence level as well for students who are improving all those things. Yoga is found to be beneficial. And digestive system. Okay, now for as far as digestive system is concerned, this will be the last slide. So I think I have time for one shot. There's a book called Why Zebras Don't Get Ulcer. If you're talking about stress and human and body health, that is the boost of zebras don't get ulcer. Now, what is in 1930s vegetables. So people it and injected in the lab mouse to see what happens to those lab. Unfortunately or fortunately, is not good at handling the mouse. So every time you took a lab mouse to inject, it used to run. He used to chase it, he used to catch it and try to inject again, it runs again, injection again. So this thing went on and on and on. Like after a specific time period, was having ulcer. Okay. Or leads he cut open that lab mouse and naturally he was not good, so he was running, catching. Because of the stress it underwent. And he's one of the modern day psychobiology is never completed without HPA axis theory again with the lab mouse and other things. In that, it is because parasympathetic only does two things: rest and digest. Sympathetic nervous system, as we all know, as fight or flight. Parasympathetic is rest and digest, so it keeps us relaxed and it helps in digestion. So parasympathetic helps in digestion. So whenever you are stressed, whenever you have ulcer, don't just look at your food habits and what time you eat. It is not only about that. Stress plays a major role in ulcer. Okay, stomach ulcer. So part one. Now for the working of digestive system, irrespective of whether it is stomach, liver, or any organ, parasympathetic is really important too. So yoga is beneficial for not just digestive disorder but also and people who don't want to eat, anorexia nervosa, bulimia, I mean, all these conditions as well, yoga has been found to be beneficial. And irritable bowel syndrome, for irritable bowel syndrome, a frequent visit to the toilet. like repeatedly using the washroom and morning time refer to, I mean, passing stools 2 to 3 times or 4 to 5 times. A few times it might be like you feel like a constipated and feel like no actual specific for this, etc. Associated with stress. Stress could be like, it could be depression, fear, worry, it could be anything. It could be anything. But IBS, it is best yoga as a way of life. Again, I'd like to conclude saying like yoga is not just asana, it is not just pranayama. Yoga also involves what you eat, what you eat, how you eat, when you eat, something called mindful eating. Now, mindful eating alone can help in secretion. That's one of the latest results in my project. The importance of yoga improving acute insulin release. It's not only like what you eat, what are the healthy foods, it's also how you eat matters. When you eat matters, and yoga teaches you everything. Sleep, as you can see, so it's also about the rest, how long to sleep, how much to sleep, moderate. PCO, infertility, and other problems are attributed to overweight alone, overweight and loss of physical activity alone, which is not entirely true, right? PCOS and infertility is not only because of your reduced physical activity and diet alone, it involves your sleeping pattern. If you're not sleeping like 6 to 8 hours in a day, or sleeping before 11 o'clock time period, there are increased risk of PCOS and infertility, which like the major clinics which you can come across now is not the heart hospitals anymore. Cardiac hospitals are not the super specialties you're seeing these days. And diabetes, no, it's only your cancer and infertility related. These hospitals are mushrooming because of the increased risk of, I mean, it might look fun, but it affects, right? And stress management as well. So yoga involves asana, pranayama, your eating pattern, your sleeping pattern, also your stress management. Thank you. Thank you so much. If you have any questions or any discussions, we can have that now.
Thank you, sir. It was an enlightening speech about yoga and about our health. And really, we are honored to have you as a speaker for today's webinar. And really, we have highlighted the theme of the day, which was really inspired all of us. And we'll go ahead to take some question. There's a question from for a college student. What is the right time, right amount of time to wait after eating before practicing yoga? I mean, I think they're asking after eating to do
How
yoga.
long should be the gap before doing yoga? The actual perfect answer would be, it depends on what you have eaten. I mean, generally they say like 3 to 4 hours is the ideal time between your meal and you're doing. But the thing is, it depends on what you had. If you just had like fruit salad and juices, all you have to do is wait for 30 to 45 minutes. But if you had like full-blown meal as such, you need 3 to 4 hours just for the stomach to be empty. I mean, what is the reason it's not going to affect your digestion? This, that, it's not about that. The lungs need to expand. So yoga, every single asana or pranayama, whatever you're doing, that needs lung to expand. If your stomach is full, which is immediately below your lungs, so when you're breathing in deeply, that's going, your stomach is not going to allow further expansion. So naturally, what happens is you feel that discomfort, and that is the reason we need that adequate amount of time, which varies between 30 minutes and 3 hours.
Okay, sir. There is one more question related to again diet. Do I need to be on a vegetarian diet to benefit from the yoga?
To get maximum benefit, yes. To get benefit, no. Right. Irrespective of what you are eating when you're doing yoga practices, you will get the benefits. But this is like what to say, like a booster pack. The moment you change your diet as well. I'm just telling you, just change only for 3 weeks, or like have it for 21 days or 1 month alone, and see what are the changes happening within you. If you like it, try or continue being a vegetarian. But I mean, I myself am not like 100% vegetarian as such. But whenever there is an option, I always prefer vegetarian rather than non-veg food. It's very glad when I go, I feel myself when I eat foods. It's not nothing to do with psychology as such as many people say and talk. Physically as well, we feel energetic when we are having vegetarian food.
Okay, thank you,
You can
sir.
still get benefit for maximum benefit.
Okay. So there is one more question from Suja Raj. She's asking to highlight specific yoga practices to manage psychological stress.
Okay. Yoga practices. Like, okay, instead of yoga practices, I can give you one single tip. If you need yoga practices, those will be beneficial. And one tip would be mindfulness. Mindfulness is like in modern day, we are all like we are on autopilot mode, we can say. Right. So we start our bike, our car from our home. We keep driving it. Our eyes would be open. We would be everything would be going on fine. We stop at every signal. When there is a red signal, we stop. When there is a green, we move. Everything would be happening. But our mind, there's always something running in our mind, isn't it? If I ask you like how many signal you cross today morning, we start at home all the way to our workplace, we might not be knowing because our mind always keeps thinking of it. Now, what mindfulness does? If you're driving, you drive. When you work, when you play, you play. And what you're doing at that point, keep your mind in the present moment. That's mindfulness. That is the purpose of all different schools of yoga. There are plenty of schools of yoga. One out of everything is mindfulness. Now, for that mindfulness, whatever you're doing, say it within yourself once. What I mean by that, I'm lifting this and keeping it on the opposite side. So I should tell within me, I'm taking this black pen in my right hand, and I'm showing and keeping it in my left side. Okay, like whenever we are walking or cooking or working, tell what we do once inside, not outside. Once inside, do it as mindfulness meditation, 10 minutes morning and night. You yourself would be seeing drastic change in your stress. Because how many of you, if I'm giving you a note and pen and asking you curtain, let's spread, draw the design of your pillow, how many of us will be able to do it? Just thinking the color of a pillow, color of the curtain, and the color of not looking into the details of it. We are seeing, but we are not perceiving it. Okay, so I mean that is the reason. Beautiful things around us, we're not enjoying it. As simple as that. The moment we start enjoying what is in the present, the future will be blissful.
Okay, sir. There's one more question. Is it okay to fall asleep during Savasana?
Yeah. Yes, you can.
Okay. And there's one more question from Priscilla ma'am. Does optic neuritis, which is an autoimmune disease, I mean, she's asking about that. And is there any particular yoga to treat optic neuritis?
It is possible, not just with yoga. It should be again a holistic thing. I would prefer making it as yoga and a naturopathy asset because autoimmune is in combination. As I mentioned, inflammation is the key for everything. Neuritis, whenever one finishes with neuritis, like arthritis and phlebitis and all these things, it is right. So the moment influence treatable. So autoimmune diseases are very much treatable, and it is very much possible. I'm sure you can go to any yoga and naturopathy centers nearby. It could be like either you can go for the gentle or SCSA, whichever is closer or closer, you can just get in touch with them.
Okay, so there's a last question from one of our participant. Is it? I mean, yoga is prescribed for the toddlers, and if so, what are the benefits for the toddlers if they practice yoga?
Benefits for the toddlers. Okay. There's one quote of Dalai Lama, like if every single kid 8 years old or taught meditation, world would be a very peaceful place. Right? So we are training our kids in such a way to be in the future. As I was talking about mindfulness, a kid is always pushed to get good marks. Only if you get good marks, you can go to college. Only if you go to college, you get good job. Only good job, you can just settle in your life. Its mind is always tuned to be in the future. 99% of the problem is because our mind is in the future. The remaining 1% is because we are in the past. If our mind is in the present, there is no problem whatsoever. There is no stress whatsoever. And yoga trains us to be in the present. Okay. So what about planning and execution? Our main problem is we think just by thinking about the future, we are planning. Thinking about the future and planning are two different things. Just if I'm sitting here and I'm thinking about what to do for my dinner, doesn't mean that I'm planning for my dinner. If I have to plan for my dinner, I sit, think about my dinner and plan. That's a 2-minute job. But if I'm talking to you in the meantime, I'm thinking about my dinner, and I'm either able to deliver the lecture here and not do anything or come to a concise decision about what to do for the dinner. Okay, as simple as that. Thinking and doing are two different things. We always confuse that. Like I'm driving and thinking of what has to be done for today evening doesn't mean I'm planning. It just means that I'm focusing on what I'm doing at the moment. It reduces the efficiency. Sitting and doing that planning, naturally I'll be able to plan in a much better way. So if you're training your toddlers to be in the present, the things are like concentration, memory, all these are like small benefits. Like it's a very tiny benefit and compared to what yoga can actually do. It can transform personality to a great extent. I mean, the potential increases manifold. As simple as that. The potential of the kids increases many folds the moment we open up these domains. The moment the kid is in the present moment, naturally it can do wonders for the kid.
Okay, sir. I think we have covered up all the questions. Sir, would you like to wrap up? Okay, fine. Now I would like to thank Dr. V. Venugopal for this wonderful session on International Yoga Day. And I would also like to thank our Managing Director, Mr. Josh Thomas and Sunoj Matthew, and our dearest Principal Dinesh Selvam Sir and Vice Principal Jolly Ma'am. And also thanks to all the faculties of Saroda Group of Nursing Institution and beloved participants of today's webinar. And also we appreciate all the participants for being here for the today's webinar. So thank you everyone, and we will see you next time. So please watch this presentation on your YouTube channel, Saroda College of Nursing, at any time, and do not forget to subscribe our Saroda College of Nursing channel. Thank you.
Thank you, Joshi. Thank you, sir.
Thank you.
Thanks
Thank
a lot.
you so much.
Thanks a lot, sir.
Thank you.
It was very beneficial to the students.
Thank you so much.
Thank you, sir. Thank you.
Looking forward for the feedback of the students as well.
Yeah. Sure, we will share you the feedback also, sir. Thank you.
Yes, sir. Yes.